Okay, folks. In the 1970s, J. Chapman, who was a physician and who was also the inventor of lethal injection, was asked to find more humane ways to kill prisoners who would undergo capital punishment or the death sentence. And so, what he did is he devised this kind of 3-drug cocktail where each of these drugs would be administered in lethal and toxic doses to the person. And this is called the Chapman Protocol. The protocol used these 3 drugs. First, sodium pentothal. This would put the patient to sleep. This would be followed by pancuronium bromide, which is a paralytic that stops the person from breathing. Finally, the person would be injected with potassium chloride, which would stop the heart, and then the person would, of course, die. Now, without even going into more detail about sodium pentothal, I do want to note on this slide that pancuronium bromide and its use itself is questionable in this protocol. For example, it's hard to say if the pancuronium bromide is being used truly to stop breathing, or if its general paralytic properties just kind of would prevent the person being injected from showing the intense pain that would be caused by an injection of potassium chloride. So there are some folks who question, like, okay, is this being used truly to stop breathing or more as a paralytic so that we can't see how inhumane injecting potassium chloride is? So once this protocol was administered and started being used, Chapman actually later admitted that he had little experience as a physician in these matters. What he was more experienced in was kind of pronouncing death of people and in examining cadavers or bodies that had already died. Now, physicians themselves, including Chapman, could not actually assist in a lethal injection due to the American Medical Association's Code of Medical Ethics, right? Doctors should do no harm. This includes not participating in lethal injection. However, this brings about not really a conflict of interest, but a major problem with performing lethal injection, since this really is a medical procedure. Due to lack of medical oversight, specifically of a physician, many executions historically have been botched. There have been dozens of lawsuits and many stays of execution where someone who was kind of on death row wasn't executed according to the timeline originally planned. And what's happened in lethal injection is that the dosing of the 3-drug regimen, as seen on this slide, was not determined by a physician, but rather was determined by someone like an untrained correctional officer. Now, despite these lawsuits and examples of botched execution, a 2008 Supreme Court ruling upheld the constitutionality of the 3-cocktail injection. But that is not the end of the story of sodium pentothal. Sodium pentothal was being synthesized in the United States by a chemical company called Abbott Labs. In 2004, they moved the production of sodium pentothal to kind of a spin-off of itself called Hospira. And in 2010, there was an FDA investigation of Hospira. They were seeing that other drugs manufactured by Hospira were being contaminated with sodium pentothal, which obviously would be a problem since this drug is used in lethal injection. So it was popularly known as this kind of lethal toxic drug. Additionally to that finding of contamination, there was a growing public outcry about the use of this drug. Of course, people weren't against its use as an anesthetic, but they were against its use in lethal injection. And so due to these two factors, Hospira stopped manufacturing this drug in the United States. At the time, it was the only U.S. manufacturer, so it was not available in the United States. And so, correctional facilities had to look elsewhere, specifically to Europe. Now, as folks were trying to kind of import sodium pentothal from overseas, there were lawsuits filed in the UK, for example, to prevent its export to the US. People in the UK were not in support of sending sodium pentothal to the US if it was going to be used in lethal injection and not just as an anesthetic. Similarly, Hospira, when they shut down their US manufacturing, they tried to start manufacturing in Italy, where they also had a plant. But in Italy, again, they were kind of blocked. They were not allowed to produce it there if it might have been used in capital punishment for lethal injection. So, at this time, folks, sodium pentothal is no longer being produced in the US. It is not accessible to physicians in the US for anesthesia, and it is not able to be used for lethal injection. Now, of course, there kind of is public support for no longer using sodium pentothal in lethal injection. However, when its production was halted, there was some outcry by physicians because they were wanting to use it as anesthesia, and so now they were no longer able to, which posed a bit of a hurdle to them. But since then, we've seen that sodium pentothal is being replaced by a drug that you may have heard of, propofol. Probably propofol was made most famous because Michael Jackson overdosed of this drug. This drug has some benefits. Patients wake up a bit more clear-headed from propofol, so it is ideal in outpatient surgeries where you come in, get your surgery done, and leave the same day. There are randomized double-blind trials showing very few differences to sodium pentothal, so it's kind of easily replaced. One isn't necessarily better than the other. And this might be the very first instance where a medical decision, so the use of an anesthesia for surgery, was not made based on scientific fact alone, right? How well it works, the ability of patients to recover after surgery, right? The decision wasn't really based on that, but it's really based on public opinion and people not being in favor of its use in lethal injection. And so that brings us to where we are today. We do not have sodium pentothal in the United States because of its use in lethal injection. And that kind of brings us from discovery to its rise as an anesthetic and its eventual fall because of its use in lethal injection. I'll see you in class.